What's good? What's good, everybody? I am heading out. I am in the airport today. We're heading out to Phoenix for the Neurology conference. I will be showing you a little bit of footage in there. Hopefully we'll bring back some good information that can help my clients. As you all know, I work with a lot of first responders, and sometimes there is head injuries that go along with it's kind of an occupational hazard that goes along with that. So we're going to see if we can get some information so I can be helpful to all of my patients that I serve out there. I'll keep you updated here as we go along. All right, so for you Air Force guys, those are what, the C-17s or C-19s, right? Those carry the big cargo, can fly over the ocean, really cool planes. We have an Air Force base here in Charleston, and that is actually, I believe, the home base of those C-17s or C-19s. I apologize that I don't know that. I should know that since I live here. Folks, we made it to Phoenix. We are here for the Arizona Heart and Brain Symposium. I swear I'll get it right one of these days. I'm staying over here at the Embassy Suites, and a really fantastic room, really fantastic inside. Great service too. Everybody's been super kind. I'll show you that in just a minute. Folks, just look at these gorgeous mountains behind me. Phoenix really is a great city. You all need to check this out whenever you get a chance. Good morning, good morning. Today's the day. I'm so excited. I am walking down to my event. This is the Arizona Brain and Heart Symposium, and I am very excited about our first speaker. Dr. Justin Hoskin is going to be speaking about the sympathetic and parasympathetic nervous system. So I gotta hustle, y'all. I gotta go get in there, get registered. Having a great time in Phoenix here. Stay with me.
To come back. I enjoyed it a lot last year, and I love making it a yearly tradition. So I'm Justin Hoskin, one of the balanced neurologists at Barrow. I see a lot of patients who present with dizziness that might be somewhat vague in origin, and as a result we often look at the autonomic nervous system to see how that might be functioning. So nothing to disclose relevant to this talk. A little bit of an outline. We'll talk about the autonomic nervous system and briefly review it. I like it's something that happens for the most part unconsciously, though certainly our thoughts and environment can help control it or activate it. It, for the most part, regulates all of our bodily functions and helps us maintain homeostasis. It adapts and responds to our external environment, and so we have that classic fight or flight response. If we're running from a lion or trying to give someone TPA, our sympathetic nervous system is probably running. If we're sitting through a neuroanatomy lecture, we might be resting and digesting. In target. So, for example, with the pupil, our sympathetic response is to dilate our pupil compared to the parasympathetic response constricts it. For the heart, we see stimulation from the sympathetic nervous system and inhibition from the parasympathetic. The little Greek figures and anatomical areas, one would be the insular cortex, and so that's demonstrated here. It's insulated or kind of hidden from the outside cortex, involved heavily with primary viscerosensory area. People tend to recognize or have heard of and famously associated with fear response or emotional response, so very important in our flight or fight responses. And then the hypothalamus, demonstrated as this little triangular area, kind of a integrator of external and internal environment, and helps coordinate our autonomic responses and maintain homeostasis, a very important area. So then a little bit more, there are some brainstem areas also involved with the autonomic nervous system. So the periaqueductal gray, demonstrated in the midbrain slice here, involved primarily with the pain response and pain modulation. And then the ventrolateral medulla, demonstrated in the medullary system here. So I've bolded some of the more relative responses that we see. So with alpha-1 receptors, you're getting excitation of smooth muscle in the blood vessels. Perhaps the one that we think about the most is with relation to the heart is the beta-1 receptors and their involvement with excitation of contractility. Beta-2 receptors, more of.
All right, folks, that was pretty awesome. That lecture really was great about the parasympathetic nervous system, sympathetic nervous system. So for us therapists, what's the takeaway? Well, number one, you need to remember that whenever a person is in panic mode, whenever a person is experiencing a trauma or reliving a trauma, right, either through nightmares or flashbacks, things like that, or intrusive thoughts even, the sympathetic nervous system can be activated, and that is going to cause a lot of reactions in the body, including elevated heart rate, dilated pupils, and they could be in fight, flight, freeze mode, right? This is when the amygdala gets activated, and us as therapists, we need to teach people how to turn that off so that they're in control of that switch. Not that the amygdala is in control of them, but they're in control of their amygdala, right? We need that to be able to work when there's an emergency, but we also don't want it misfiring when it's not needed. So what are the number one ways we as therapists can teach people to start to regulate that themselves? Well, there's two things that they really need to work on first. Number one is that good, deep diaphragmatic breathing, the belly breathing, right? So breathe in all the way down to your belly. Your belly should be lifting up a little bit. And when you exhale and hold it for a second, it's real slow, in through the nose, right? 1, 2, 3. Hold it for a full second at the top. Exhale through the mouth. 1, 2, 3. Full pause at the bottom, right? Have somebody do 5 sets of that and then see how they feel. Repeat as needed until the heart rate goes down and their mind is not racing and the breathing feels like it's under control. The number 2 thing people need to be doing when they're trying to get that panic, fight, flight, freeze mode under control is managing your thoughts, right? So what you want to be doing is thinking thoughts like, okay, I know what this is. It's just a panic attack. It's going to go away. It's temporary. I'm going to be okay. I'm not going to go crazy. I'm not going to die. I'm not going to stop breathing, right? And if they can do that, that's half the battle. If they can switch it to, oh, hey, you know what? I've had this before. I know I can get this under control. Let me focus on my breathing. This is going to go away in a few seconds, right? That's going to be even more effective, but most people can't do that in the beginning because they have to experience some success with it before they do it. All right, I got to get moving here, folks. Trying to catch another meeting. Hope you enjoyed this. Remember, mental health matters.